hospitals become more efficient, they are able to see more patients, and private hospitals, their cost of rendering healthcare also goes down. So that is an area where I think AI is really going to play a massive role in the coming years. And already we have the medical device companies, they are introducing more and more AI tools to make their devices more efficient. So already Philips, I was speaking to the CEO. So they have introduced AI in their imaging devices, and with lesser number of scans, less exposure to radiation if you're thinking of a CT or an X-ray. So with lesser number of scan, you actually are able to get the right diagnosis as to what is the issue like with that particular patient. So you are able to use the machines more efficiently. And if in a particular day you are using a certain scanning machine for say 25 patients, you can maybe enhance it to 50. So that automatically reduces the cost of rendering these diagnostic services. So this is an area where I think a lot of work is already happening, and in the coming few months and years, software as a medical device is really going to gain prominence. Already we are having a number of startups in the country who are working in this area. And I think the floodgates are just about to open. So this is how I think we see the usage of AI to basically reduce the cost of healthcare in the country. So that is the ultimate takeaway for the government in this area. Thank you very much.
Thank you. Thank you. I think this is a nice segue to ask Nico a question about the use of AI in healthcare, particularly in the Netherlands. What are the key system enablers that you have seen that has enabled this to happen in a successful manner?
Yeah. Thank you very much for the question. First of all, let me thank Philips for hosting this event. As you can imagine, at the Netherlands Embassy, we have a very special relationship with Philips, and therefore we are extremely happy to have the global CEO of Philips, Roy Jacobs, here in India. It's for various reasons, just very shortly, but if you allow me, a very special week for us, because as the Netherlands, upon the invitation of the Indian government, we have been co-chairing the work group on AI for economic growth and social good over the past 3 months, I think. So this week is a very special week that a lot comes together in this week. I said co-chairing, that means that there was another co-chair, that's correct. The other co-chair is Indonesia, and I think this really shows very clearly how we can create alliances, like in this case between the Netherlands and Indonesia, coming together in this particular week. Now let me get to your question, obviously. Maybe just getting a little bit back, back in 2019 in the Netherlands, we had a national program called Valuable AI in Healthcare. There we stimulated, as a government, Ministry of Health, that I represent here, a lot of pilots on AI in healthcare, and also helping our medical institutions with ethical guidelines in AI. That probably explains why exactly 1 year ago, the WHO decided to designate our Digital Ethics Center at the Technical University in Delft in the Netherlands as the first WHO collaborating center on AI health governance. This is obviously worldwide applicable. If time permits, I'm happy to say more about what this WHO collaborating center on AI health governance is going to do and how it can help the entire community in the world to deal with the questions that Dr. Paul rightly set out from the start. Now, with this experience on our national program, Valuable AI in Healthcare, our Minister of Health sent a document, a policy note, a new strategy to our Parliament in October 2025. So that's still very, very recent. And that's called Realization of AI in Healthcare. Exactly what Dr. Paul was also stressing, the importance to get to realization. So with this new program, we are shifting our focus from experimenting with AI to implementation and scaling up of AI in healthcare. How are we doing that? By a two-track approach. First of all, stimulating innovation with AI by addressing, one, labor shortages, to medical needs. The second track is guaranteeing public values. We do that through legislation, and in particular EU legislation. Very briefly on the EU, because that's very important for us, of course, as the Netherlands, being one of the founding members of the European Union, is first of all the EU AI Act. That's the worldwide, the first legal framework for AI or for AI systems. It's a risk-based approach, which is clear, subdividing in unacceptable risks, high risks, limited risks, or minimal risks, and that gives you clear guidelines for companies, for knowledge institutes, for governmental organizations. What kind of measures do you need to take? So it's not purely bureaucracy, it really helps you to get this level playing field, and in order to make sure that we implement AI in a responsible way. Now, this goes in parallel with the EU Apply AI strategy, when 1 billion euros have been reserved to do exactly what Dr. Paul was mentioning, speeding up the adoption of AI and also integration of AI in the core processes of different sectors, focusing on scaling up, so removing the obstacles and also allowing very much SMEs to apply AI in their processes. Specifically on health, Bharat, and I will end with that, is that this allows to streamline market access of medical devices with AI without compromising on patient safety. I will stop here, and maybe if there are questions later, I can go further in detail. Thank you.
Thank you, Nico. I think quite clear-cut, right, that you see actually it works when you implement it with the right boundaries and the right guidelines. That leads me to a very interesting perspective that I hope to get from Dr. Panigrahi. AI depends on the clinicians believing in AI as much as patients wanting to use it. In your diverse experience, and you've seen many trends over the course of your career, how do you place AI in terms of welcoming AI by clinicians? What are the concerns? How do you see that scale up in the clinician context?
Yeah, first I would like to say thank you to Philips for organizing this. And I'll go back to the FICCI Hill, which happened a couple of months back. I think Dr. Paul very rightly mentioned that healthcare has to adopt AI. There's no stepping back now. So I think so, whether it's the public sector, private sector, I think so everyone has to start looking at it. And from Fortis perspective now, what we have started doing is that we have created a complete innovation cell headed by a senior doctor who is the administrator to see that how do we sort of adopt AI to make the patient's journey comfortable. So in other words, I mean to say that when the patient enters the hospital, they know that they have come to the right place, right hospital, the right doctors, so that that journey is important. So these things are now being built up by chatbot, by a lot of digital formatting that's happening with the QR codes and all that. So I think so, just coming back to Philips, I think so, I was there in Singapore last week, and they have adopted a hospital which is a smart hospital in the sense that lot of talking that happens when actually most important person in the hospital is the nursing. Nursing care takes about 70% of the healthcare needs. But if you look at across the globe, and more so in India, if I can put it, the nurses are called for a lot of mundane work, which is, they takes away time from their healthcare work that they should be doing. So this, what they have done is that, I saw it there, that the healthcare, a lot of things that are not nursing related, you can access it. And these have been made there. And these are the things that we're not implementing in our place also. So that helps the patient in the journey. We can spare out time, bring in efficiency at the bedside level care. So that's there. And the other part is that even now with the insurance things increasing, AI is a good tool to sort of screen through the insurance adoption. So essentially, these are the ones that we have done. And in the, I don't want to take steal Dr. Harsh Mahajan's thunder. In radiology, also a lot of things that he has done, we have started implementing it. So it gives us access to preemptive care in the sense that we pick up things much earlier than what was there earlier. Simple things like getting all the X-rays digitized. You are able to pick up early lung cancers much earlier than what we were doing earlier.
Thank you. I think this is very encouraging to hear the clinician's perspective and adoption. Honorable Ministers here, thank you, ma'am, for joining us today. We just have a couple more questions. We'll wrap up before we hear from the leaders, just 5 more minutes. So maybe I'll turn it over to Dr. Mahajan. You are very connected to the ecosystem of startups that are working on healthcare and AI. Can you give us a perspective of, what do you see? How excited are you about the future of AI in healthcare?
Thank you very much. At the outset, thank you, Philips, for having me here. And let me give you practical examples of what India has done in the last 10 years for AI in healthcare. It may surprise many to know that the first paper ever written in the Lancet on AI came from India in 2018, which means it was for critical findings on head CT scan of the brain, which means work was going on in 15, 16, 17 to be able to, have a product which could be used to detect automatically brain hemorrhage, midline shift in the brain. So it is great focus that the government is giving now, but in some part that focus both by the government and startups and academia in this country had started when deep learning started in 2016. 2, if we look at government programs, then the TB program in this country, since over 2.5 years, with handheld X-rays and AI in a laptop, millions of people have been scanned, X-rays done, and with AI, what is done, you find out whether the X-ray is normal or abnormal. The abnormal ones are then taken up for the next level of examination, so that asymptomatic people at a population level, and remember, we are 1.4 billion, but this work is on district to district, village to village, town to town, this is happening. Another initiative, again, breast cancer is rampant all across the world, also in this country. What has been developed by one of the labs down south is a bra which has thermal detectors within it, which is able to pick up, again, at a population level. We have to think population level, and Dr. Paul very rightly mentioned that. This takes 10 minutes. The lady wears the bra. The signal coming from it goes to a computer, which uses AI inside. And this was about 4 or 5 years ago. Of course, it's still to be implemented at the practical level because, like it was said, validation has to be done at a large scale, and you don't want to miss cancers. But this is the initial level where those who have suspicion of breast cancer can be segregated from the thousands that are scanned and then sent for mammography and whatever else may be needed. This is what is happening in this country. What I feel, and I make this statement very responsibly, that if used ethically, if used properly, AI in healthcare can only be beneficial, especially if used under supervision of healthcare professionals and not by lay public at large, where they feed their data into ChatGPT or whatever and try to figure out what's happening. So that's very important. Then, as has already been said, already our CT, MRI, ultrasound equipments have AI inside, dose reduction of radiation on CT scans, faster, higher quality scans on MRI and ultrasound, and actually automatic recognition of lesions. And going forward, we have, like Dr. Paul said, we work in silos: pathology, microbiology, radiology, nuclear medicine, genomics, proteomics, metabolomics. It is only AI of the future which will be able to break these silos so that we are able to give pre-digested, if I may use that word, diagnosis to a person, to a doctor sitting in his clinic to be able to treat. So I think the future is bright, and the youngsters of this country, I'm sure, will do what Dr. Paul wants from them. Thank you very much.
Thank you, Dr. Mahajan. And to wrap up the panel, question to Neeraj, my good friend. So in a resource-constrained environment, like you've seen many times happen, AI can be a force multiplier. What is your perspective on that? How can AI help in a resource-constrained environment?
Thanks a lot, Bharat. Thanks for having me here, respected Minister. Dr. Paul, of course, I always listen to you very carefully, sir. Every time I get inspired when I listen to you. An ex-boss of mine once said that it's not about AI and digital, it's about health. And I think that reminds me every day that let's focus on health and look at AI as a means to get there. And there's a lot of AI out there. In fact, the noise is getting a little too loud, I feel, especially under this roof at the moment. But I think really, if you think about the public health system and if you think about health equity, we are seeing a lot of bright, shiny objects out there. There are a lot of innovators doing some great work, but are they actually getting to what Dr. Paul actually referred to? Are they actually talking to the health system? Are they actually thinking about equity? And I think that's the direction we need to go. So a few things that we've actually found to be very important, and I want to send that message out. Firstly, building an AI system is not going to help unless you are embedding it in the public health workflows. And that's when we're going to see real impact. So how are they actually fitting in? Can they actually even be rolled out? Are they cost effective? Can they be used as triage tools? Not necessarily, a lot of people walk in saying this is a diagnostic, but actually maybe they just could be used as triage. Laws to follow up, TB especially, and Dr. Mahajan talked about that. NCDs, people, fall off the map. So that would really help the public health system. We need to build on digital public infrastructure. I think that's another big one. And Ayushman Bharat Digital Mission has really shown us the way. That's, to me, the gold standard globally. We need to build on that. We need to have, they've got open APIs, any of us can connect onto it. So unless we do that, data is not going to come together. The system's not going to come together. And I can see Bharat is nervous, so I'm going to go quick, Bharat. Give me another 2 minutes, all right? We need to design for low resource settings. AI is not only a tool for rich people wearing those great, nice watches. I still wear an old analog, but those digital watches which are telling you every minute what's happening. Let's design for low resource settings where resources are scarce, including government resources, all right? We've got to prioritize. So let's try and design so that they're cost effective, both in terms of usage as well as in terms of the equipment itself. Finally, the frontline worker who's going to use this, let's not burden them, and we are burdening them. All the technology that's going out there, when we go out into the field, we find that people are just layering technology after technology. And I think, NGOs like us do that more than anybody else. So I think we are actually, to some extent, to blame. But decision support systems have been very useful for the frontline worker if you've got a decision support system which is guiding them. And finally, we have to have governance at the center of it. We need to have validation. We need to make sure that humans are in the loop. So I'm going to stop there and hand back to you, Bharat. I think it's time to walk off the stage. And
no, I think, so first of all, appreciate the enriching discussion. We're going to hear more from everyone. Thank you.
Thank you. Thanks to all our panelists. Please stay back on stage. We do have a group photograph. But before that, I would like to invite Mr. Roy Jacobs, Chief Executive Officer, Royal Philips, on stage, and join me to welcome Srimati Anupriya Patel, Honorable Minister of State for Health and Family Welfare and Ministry of Chemicals and Fertilizers, Government of India. And ma'am, thank you so much for making time. We understand you're traveling after this. Yeah. I can't afford to catch. Rishi. If we could request all the panelists and everyone to gather here for a group photograph, please. Along with Roy and ma'am, please, before the panelists go back to their seats. Time for all cameras to be up, photographs to be taken. Thank you so much. I would like to request Roy to be on stage and Srimati Anupriya Patel to also be on stage, please. And with that, over to Roy. Dr. Paul, we would request you as well to join us on stage.
Good morning, everyone. Thank you for being here today. A special welcome to Madame Anupriya Patel, Honorary Minister of State for Health and Welfare and Ministry of Chemicals and Fertilizers, Government of India. It's an honor to join this community of healthcare leaders, innovators, clinical leaders, and partners. The fact that we are all here reflects something really important, because healthcare is at an inflection point. And so, given the responsibility we all have, and let me be very clear on this, I believe artificial intelligence will have its greatest impact in healthcare. And the shift has already begun. Healthcare systems globally and also in India are under unprecedented pressure. There's rising demand, growing complexity, stretched workforces. And that pressure is and will have to accelerate the adoption of data and AI-driven innovation. And with that, we are moving towards an integrated AI-enabled healthcare. That's a healthcare system where intelligent systems support clinicians and nurses to make faster, better decisions. Across the ecosystem, I see the momentum building. And the opportunity will only expand as data scales and AI evolves. But AI alone can and will not transform healthcare. It must be embedded in systems where data, workflow, and clinical expertise work seamlessly together. And those systems ultimately must serve the people at the center of healthcare, because healthcare is all about people. Just consider for a minute the pressure care teams are under. If you ask clinicians what they need most, the answer is almost always the same. It's time. Time to think, time to explain, time to connect with patients. Yet too much of the day is consumed by documentation, fragmented systems, and administrative complexity. And this is where I, in particular, is making a difference. The first wave of impact may not be that flashy, but will be truly transformative. AI that automates repetitive steps. AI that supports documentation in the background. AI that prioritizes urgent cases. This is not replacing clinicians. It's about augmenting them. At Philips, we design AI to work inside the clinical workflow, always under human oversight. It's embedded, intuitive, freeing up time. Because when we give time back to care, we will improve care. It's that simple. Let me make this a bit more tangible. The gold standard in diagnostic imaging is going to be autonomous MR. Imagine this. A patient arrives for her MRI and checks in smoothly. Her clinical information is already available to the system. AI helps position her accurately and selects the optimal scan protocol. It's tailored to her autonomy. As the scan runs, image quality is continuously monitored and adjusted automatically. The result: clear, precise images, delivered efficiently and consistently. The radiologist receives AI-driven insights and quantitative biomarkers. This is autonomous MR, and Philips is working to make this a reality. It means more patients diagnosed earlier, earlier detection of chronic and complex conditions, more personalized, high-quality exams delivered at scale. It expands capacity, it reduces variability, it scales expertise, and over time, it helps reduce the overall cost of care. At Philips, we have been laying the groundwork for this future through advanced automation, integrated MR workflows, and AI engines that make scans faster while enhancing quality. And we are a leader in helium-free MR. These systems not only are more sustainable, they also allow MRs to be installed in locations outside of hospitals, where it was previously not feasible to do MR scans. That means more access, closer to patients, more resilience, and more patients served. Now imagine a hospital room where data from monitors, devices, and systems flow into one unified platform. AI continuously analyzes patterns to reduce false alarms and detect subtle deterioration quickly. Instead of reacting to crises, clinicians are alerted with context and predictive insight. That is the shift from reactive to predictive care. This is where AI can receive patterns, reason within defined guardrails, and support action in real time, always under human oversight. We are making it happen together with partners. Our innovation platforms connect hardware, software, data, AI, and human expertise. This is how we move from isolated innovation to system-level transformation, and that is what we need in healthcare. We are ready to scale this across our install base globally and working across the globe with all our partners. What is crucial to enable this? It's all about trust. Healthcare runs on trust. AI, therefore, must be transparent. It must be validated continuously. It must protect patient data rigorously. It must operate within evolving regulatory frameworks. Responsible AI is foundational. Human oversight remains central. And governments and innovation must move together, protecting trust, building confidence. Why is this so crucial? Because if trust erodes, adoption stops. And it's all about adoption. But if trust strengthens, transformation accelerates. And that's what healthcare needs. Now, I'm very happy to be back in India. India represents a remarkable opportunity in this transformation. The scale, the digital infrastructure, the ambition. Initiatives such as the Ayushman Bharat Digital Health Mission are laying the groundwork for interoperable data and continuity of care at population scale. Exactly the kind of foundation AI needs to deliver meaningful impact. For Philips, India has been for almost 100 years not only a market, but a global innovation engine. We have a big part of our innovation population based out of India to innovate for the world, also especially in AI. Through our innovation campus in Bangalore and the Healthcare Innovation Center in Pune, teams are here contributing to our global R&D, AI engineering, connected care platforms, and clinical workflow solutions. Solutions built in India and deployed across the world. And that matters because solutions are designed for scale and for complexity, and they tend to be resilient everywhere. India has a massive need for healthcare, and therefore you think about how to scale healthcare in a different way. If we look ahead, 10 years from now, success will not be defined by how many algorithms we have deployed. It will be defined by the outcomes they generate. Early detection of disease, fewer avoidable complications, shorter wait times, greater access to care, more time for clinicians. And healthcare will move from reactive to predictive, from fragmented to connected, from episodic to continuous. That's the promise. And so finally, let me return where I started. AI will have its greatest impact in healthcare. The systems we build today will shape the future of health of billions tomorrow. And at Philips, we are committed to building that future responsibly, at scale, and together with all of you. Thank you.
Thank you, Roy, for sharing your thoughts. Now, everybody, please put your hands together and join me to welcome Srimati Anupriya Patel, Honorable Minister of State for Health and Family Welfare and Ministry of Chemicals and Fertilizers, Government of India, for a keynote address on health sector policy priorities for AI adoption. Welcome, ma'am.
Thank you very much. I think I owe my apologies to Dr. Paul. He should be speaking before me, but I'm running short of time, so allow me. It's always a pleasure to listen to him. I've missed out on the opportunity. Well, Mr. Roy Jacobs, the Chief Executive Officer of the Royal Philips, Dr. V.K. Paul, Member Niti Aayog. I have my Joint Secretary here, Aman Sharma ji from the Department of Pharmaceuticals, and Mr. Nico, who's the Counselor of Health, Welfare and Sports, Embassy of the Kingdom of Netherlands, and a few of our panelists. I missed out on listening to the views also. Mr. Bharat Shesh ji, who's the MD, Philips India, Dr. Harsh Mahajan ji, Dr. Bishnu Panigrahi, Sri Neeraj Jain, and all our industry captains who are here today, all our distinguished members of the medical fraternity, academia, and friends, a very good morning. To begin with, I would like to thank Philips for having me here. And I would also like to welcome all the distinguished participants who are here today for the India AI Impact Summit 2026, one of the flagship events of our government, and a 5-day event over which we will see lots of global minds, Indian talent, and several technical experts from all walks of life who will be assembling here at Bharat Mandapam and sharing their perspectives on artificial intelligence. Friends, AI for India, as our Honorable Prime Minister Shri Narendra Modi ji believes, is not artificial intelligence, it is all inclusive. That's our definition of AI. So when we speak of AI in healthcare, we just don't think in terms of the sophisticated algorithms and the promise of precision. For those of us who who sit in the government, the real measure of the power of AI lies in the extent to which it is able to touch lives and the extent to which it is able to address the health inequities. That's the governance model we follow, in which AI becomes an enabler and a force multiplier, and it is able to take us closer to the goals of inclusivity and health equities. Today, India is marching ahead with a big vision of building a developed nation by 2047. And when we envision a developed India, health becomes an extremely important pillar. And India has unique challenges. Our vast and diverse population, rural and urban divide, and also the dual burden of non-communicable as well as communicable diseases. So when we look at these unique challenges, it becomes extremely important that we make use of technology. And we have had a comprehensive technological integration in our national healthcare framework, which we don't see as only adoption of technology, but a strategic response to the unique challenges that we have. And today, we have integrated AI in the entire health continuum. So from disease surveillance to prevention to diagnosis to treatment, it's everywhere. And it shows the power of AI in bringing about a transformation. I have a couple of examples of the AI tools that we have used. So, firstly, in media disease surveillance system, that's one of the AI tools we have been using. This is a tool which has helped us to monitor digital news in as many as 13 languages and then make disease alerts. And this helps us to generate real-time data alerts for the disease outbreaks and showcases the strength of AI, the power of AI, in augmenting our efforts towards disease control and enhances our surveillance capacity. In India, we also have One Health mission now. Under this mission, the Indian Council of Medical Research has also launched an AI tool which surveils the genomes and predicts the zoonotic outbreaks before the transmission actually takes place from the animals to the humans. And I heard one of our experts, panelists talk about the use of the adoption of AI-supported handheld X-rays in our TB screening program. So we have brought this technology closer to the community by deploying these AI-enabled handheld X-rays in our intensive TB elimination efforts. And there are other solutions. There is Cough Against TB, which has generated a 16% additional caseload. And this includes the asymptomatic cases, which were till now out of the system's reach. Similarly, we have the prediction of adverse TB outcomes. This tool has also contributed to a 27% decline in the negative treatment results. And today in India, considering the fact that we are a very huge population and it's a low resource setting, so we have to look at solutions which are scalable and which are frugal and which address the systemic gaps, instead of focusing on solutions which could be more suitable for the resource-rich health settings. So there are many examples of how we have used different AI tools for bringing about transformation and strengthening our efforts towards inclusivity in healthcare. And AI cannot be taken forward unless we have a supportive ecosystem. In India, we have made efforts to build that supportive ecosystem as well. So our premier institutes like the All India Institute of Medical Sciences in New Delhi, and also the AIIMS Rishikesh, PGI Chandigarh, and two other reputed institutes. These have been designated as centers of excellence for AI in healthcare. And we follow a collaborative framework under which several ministries of Government of India, along with the research bodies like ICMR and the private sector, they come together and develop solutions which are not just clinically relevant, but also validated to address the unique healthcare challenges of our country. Friends, today we also hear that there is a great amount of debate going on about the use of AI and what impact it is going to have on our clinicians. So there are a significant number of doctors and clinicians who are convinced with the strength of AI, but then there are also fears that AI might be a threat to doctors and clinicians. AI could replace. And I feel that these fears are largely misplaced. Because AI is here to augment. AI is here to assist. AI cannot replace the clinicians. At the most, what it can do is, and that will be in a positive way, it will reduce the burden of the doctors. The routine, high-volume tasks will be carried out by AI, and the doctors or our specialists can focus on the complex cases or clinical decision-making. And the non-specialists, they can also benefit from AI, because they will also be elevated in their roles and they will also operate at the top of their expertise. So there are several benefits that AI brings to our medical fraternity, and the fears that the AI could ever replace clinicians, that are not really true. We must never forget that medicine is not just a science. Medicine is also an art. So when a treatment proceeds, healthcare thrives not just on algorithms. Healthcare thrives on human touch, on empathy, on compassion, on communication between a clinician and a patient. And this human touch can never be provided by AI. It is only a clinician, it is only a doctor who can communicate with this patient and provide that compassion and empathy that is needed by a patient. So what the doctors need to worry about today is AI literacy. Now, our future-ready clinicians need to be AI literate. It's a necessary skill which is now needed for all our doctors worldwide, and especially the global south. So I urge all the members of the medical fraternity who are present here today to spread this message that AI cannot compete with clinicians. It can only compensate for their absence. And our doctors and our clinicians need to be AI literate. And I'm very happy to mention that the National Board of Examination in Medical Sciences in India, it has very recently launched an online training program on AI in healthcare for our doctors all over the country. It's a 20-hour special course through which they will be introduced to the fundamentals and the benefits of AI. Another aspect which is more important is when we talk about a greater use of AI in healthcare is the ethical use, the responsible use. And for that, we need very strong regulatory frameworks. In India, we have created those robust regulatory frameworks so that AI is used ethically and responsibly. We have the Indian Council of Medical Research, which has come up with guidelines on the ethical use of AI. And also because AI can never be held responsible for its decisions, but humans must be. So our national regulator, CEDESCO, is now working on developing the guidelines for the use of AI and software as a medical device and also software in medical device. During this AI India Impact Summit, we will also be launching our strategy for AI in healthcare for India. This SAHI, or the strategy for AI in healthcare for India, will be like a national guidance framework for all our states, for all our regulators, for all our private programs and actors, public programs, rather than a prescribed centralized mandate. And it is proposed to be released during this AI India Summit on the 19th of February. I'm also very happy to say that India, because of its continued commitment to responsible and ethical use of AI, has also recently joined the Health AI Global Regulatory Network as a pioneer country, and it is collaborating with the UK and the Singapore and contributing to the sharing of safety protocols. And this ensures that the vast experience that India holds in digital health innovations can now contribute to establishing safer global standards for all. So all I wish to say is that innovation excites, but what's important is endurance. It's important that we not just innovate, but we also incorporate it in our national policies, national programs, and also in the everyday work habits, work culture of our clinicians. So our medical fraternity has to be AI literate. It has to be updated with the newest AI-based tools which are coming, and they should be used very responsibly as well as very ethically. That is what, and safely. That is the most important thing. So with this, I would like to thank you all once again for having me here. And I only wish to urge all the participants who would be present for the discussions that will continue, that we have to come up with recommendations which will provide us more scalable and frugal innovations, which will be able to address the global challenges. Thank you very much, and all the best for the upcoming discussion.
Thank you, ma'am, for sharing your thoughts. With that, I'd like to thank all our panelists and speakers for their time today, and thanks to all of you for being a wonderful audience. Enjoy your day ahead.
We request the honorable speakers to stay back.
They're asking for a bite. He's giving a bite outside. Let him give it.